Hello and welcome to another Scotland Clinics update. My name's Emily, I'm from the Fertility Network team, and today we're very pleased to be joined by clinics from Aberdeen, Glasgow, Dundee and Edinburgh. From Aberdeen, we have consultant Dr. Maheshwari and centre manager Alison McTavish. Joining us from Glasgow, we have lead clinician Dr. Helen Lyall and lead embryologist Joanne Leitch. From Edinburgh, we're welcoming quality manager Dave Wales and business manager Kelly Hayden. And from Dundee, we welcome consultant Dr. Silva. Chief Executive of Fertility Network UK, Gwenda Burns, will moderate a Q&A with the clinics today. But before then, just to kick us off, Alison McTavish and Dave Wales will give a presentation on fertility consents. Thank you. Over to you, Dave.
Thank you. So I'd like to start off, we're going to talk about the electronic consent platform we'll be introducing across all 4 Scottish fertility centres. So this will go between Aberdeen Fertility Centre, the Assisted Conception Unit in Nine Wells in Dundee, the Edinburgh Fertility Centre and the Glasgow Royal Fertility Centre. So the implementation of this system has only been made possible thanks to the Scottish Government approval and funding, which has been expedited due to COVID-19. So prior to introducing this system, IVF treatment, is very important that patients are given access to all information about every aspect of their treatment. This information needs to be easily understandable, and especially around things like risk and potential outcomes of treatment. To provide this information prior to consent, we call this be able to give informed consent. So a record of this informed consent is what's required by our centres for certain aspects of our care, but also by the HFEA, or the Human Fertilisation and Embryology Authority, who are legally required to have those consents in place before treatment commences. So before, what we used to do is we provide information in different ways in different centres. So this would be a one-to-one consultation, patient information evenings, things like that. And once you were given that information, you receive paper consent forms. These can total around about 40 pages sometimes. These are all posted out to you once you've been provided with that information. Now, we're trying to massively reduce the number of people coming through the hospital settings and reduce those face-to-face consultations. So only those that require physical examinations are now going ahead. So consultations are normally taken now using kind of video technology, such as Near Me, or sometimes over telephone. Patient consent platforms can provide exactly the same information with the added benefit of having small quizzes throughout to allow you to test your knowledge. So this can also be addressed with your clinician at your consultation. So what other benefits are there? Of course, you can do it from your own home at your leisure. So it means you're not having to fill them out in clinics or kind of to a sort of timescale. So when you're logging into the profile, you're able to set up how you would like to access that information. So all the forms, all the resources can be moved into different formats, such as larger text, voice dictation, and of course like screen brightness, things like that. It supports systems such as screen readers for visually impaired users, and has a set of predefined profiles for other impairments to meet your needs. This can include things like on the left-hand side, you'll see their ADHD friendly profile, which darkens the majority of the screen and gives you a small reading pane to prevent from distraction. So as I said before, you can do this in your own home, but you can do this on a multitude of devices, be it telephone, on your tablets, laptops and PCs. Anything with internet is internet enabled and has a web browser on it. But should you find yourself unable to access the internet, or you don't have a web-enabled device, the centre can provide you with paper copies of your essential consent forms and information. However, this may require a couple of additional appointments just so we can verify that you understand all the information that's been given on the paper copies. So with that, I'll now hand over to my colleague Alison, and she will complete the remainder of the presentation. Over to you, Alison.
Thanks, Dave. Okay, so how does it all actually work? Well, each individual will receive a text message, and in that message you'll have a unique patient ID, which is randomly allocated by the system, and also a unique phrase, which is also random, as well as a link to the consent platform. When you actually go into the platform, you'll use your unique phrase to log in, and then you create your own password. The forms and information that's available are specific for your treatment at that time. So once you've logged in, you can go back and forth to the platform as often as you wish and log in at any time once you've got your valid ID and your password. Now, the access is specific to each individual, so please do not allow others, including your partner, to access your account. Before you start on the platform, you really should have photographic ID, as this is required fairly early on in the platform. You can do this easily by either uploading a scanned copy if you have one to hand, or take a photo of your ID on your phone and upload that. There is a lot of information, and I would reckon that you need to take at least an hour to an hour and a half to go through the whole platform. But the good news is, as I've already said, you can go back and forth when you want and if you want, so you can take your time. Information is available in other languages, and you need to contact your centre to have that for your benefit. Within the videos, there are subtitles available, and all the videos all the way through. And Dave previously mentioned that there are quiz questions. The answers are in the presentations. These are just to make sure that you've actually read through and that you fully understand what's happening on the platform. You can replay any part of the video at any time. You can stop and start, and centres may have some specific information below some of the videos. You can see here that this is a presentation looking at the whole treatment cycle, really, and you can see there's text, there's graphics, there's a timeline along the bottom which shows that this is an 8-minute long video that you can stop and start, increase the volume, make bigger, whatever you need to do to make it accessible and easy for you to understand it. Please take your time and go through the processes together if you're undergoing treatment as a couple. You'll see that there are some parts about you as a patient and about your partner. There are some decisions that need to be made jointly, and these are worth discussing as you go through, but the platform does remind you very clearly that before you complete the consent forms, please discuss your choices. There are some parts in the form that it's really beneficial for you both to submit the same information, such as correspondence to your GP, and especially around the length of storage or use of any embryos created. Please complete the forms as soon as possible when you get the information, but you will be reminded to submit the forms, and you will get a text message around 14 and then again 10 days before your appointment, just to make sure that you haven't forgotten to do them. From the clinic side, we can actually see if you've logged in and how far through you are on the consent platform. We can see how long you've spent in each area. So if there's any area that you've spent a long time or indeed a very short time, then that can be picked up at your consultation and discussed further. So that's a very, very brief overview even of the electronic platform for fertility patient consenting. We really are looking forward to feedback. So far, the main comments that we've had has been regarding the amount of information. There's a lot of videos and written information in the consent forms, and that it does take a bit of time to go through, which is why I was suggesting that you maybe do it in bite-sized chunks. And as Dave has already said, you can do this in the comfort of your own home over a cup of coffee, or indeed lying on the couch. The first cycle will take the longest, and once done, it may be 2 years before you need to repeat some of the forms again. This is a new initiative, and we're all very excited about it in the centres, and we hope you are too. If you have any questions, please contact the centre. We're all learning and how to use this media as best as possible. So thank you for working with us and sharing your thoughts going forward. And now I'm going to hand you over to Gwenda, who will pick up any questions.
Hi, thank you to Dave and Alison. That was really informative and will be really helpful for people to be able to watch now, but also to be able to watch in the future. we've had some questions submitted about the overall services in Scotland. So if we can just move on to them, and if I could come to Dr. Maheshwari and ask, could you clarify what documented evidence is needed regarding the MMR vaccine to stop further delays when reaching the top of the list?
Thank you, Gwenda. This is a very good question, and it really relates to a lot of people. Just to kind of reiterate that we are in unique position in fertility clinics to ensure that everything in the pre-pregnancy status is optimized. Traditionally, we have always tested for rubella immunity, and that is because if you catch rubella in pregnancy, there is a risk of miscarriage, stillbirth, and developing babies are at a risk of anomalies or birth defects, which can be potentially devastating lifelong consequences. We know that rubella immunity is no longer available in a number of centers. It's still available in a few centers, but majority of the clinics, rubella immunity check from blood test is no longer available. So the best way we can get the evidence is by MMR vaccination evidence, which is actually better because you get by having MMR vaccination, it provides you protection against measles, mumps, and rubella. And everybody has it when they are young. So we need evidence of 2 doses of MMR vaccination. In answer to the specific question, you shouldn't need to wait when you reach at the top of waiting list, because we normally ask for this evidence at the time of initial referral for the fertility consultations from your doctors. So if that evidence is available early enough in the journey, you shouldn't need to wait for the treatments as it is.
Thank you. And Joanne, are patients tested for COVID-19 prior to starting treatment?
Hi, Gwenda, thanks. When the clinics restarted treatments after the initial pause and the first wave of COVID, we introduced COVID testing of patients who are undergoing egg collection. These patients are swabbed for COVID on the day of the final ultrasound scan, just before egg collection. Patients who are not undergoing egg collections are not required to be tested. But whether patients are being tested or not, we are still asking patients to be mindful and make sure that they're following Scottish Government guidance and advice to try and reduce the risk of transmission and infection of COVID. We are aware that some patients will be undergoing lateral flow testing, perhaps as part of their occupation, and we are advising that that's still okay to continue with that during your treatment, and just make sure that you're following your employer's guidance if you do get a positive result from that. And we also advise that prior to coming to clinic for any face-to-face appointments, we are still carrying out a verbal check to make sure that you are free of any symptoms of COVID.
Thanks, Joanne. I think that makes things really clear. And Dr. Lyall, for patients who require surgery on fallopian tubes before starting IVF, has this service resumed? And if not, is there any indication of when it will restart?
Thanks, Gwenda. We do, we are sorry for anyone who is waiting for surgery on their tubes. We realise that it is an anxious time for patients. Like a lot of things, the pandemic has had an impact on waiting times for surgery really across the board. And in recognition of that, if you are waiting for surgery on your tubes, we are happy that your IVF cycle goes ahead and you can freeze your embryos, then have your surgery at a later date, and then have the embryos replaced rather than delaying your IVF cycle.
Great, thank you. And Kelly, can I ask, how long is the waiting list at the clinics for new NHS referrals?
Hi Gwenda, so at the moment we're pleased to inform that all the clinics are able to see the majority of their patients within 12 weeks for their initial consultations regarding their fertility. All those patients were then referred for treatment for having IVF and ICSI within the waiting times standard set by Scottish Government, and further details of this can be found on the Public Health Scotland's quarterly publications of IVF waiting times in Scotland, with the most current version published last month with the data up to the end of December 2020. All the clinics have been working really hard to continue to meet the targets despite the challenges imposed by the pandemic, which has meant all clinics were closed for around 12 weeks last year at the end of March during the first wave, and restarting services required many changes to be made the way we operate. However, we are pleased to be reopened, and we can reassure you we're doing everything to treat you as safely and as soon as possible. So thank you for working with us and being patient.
Thank you, Kelly. And yeah, I would reiterate just how hard the clinics have been working and extremely how well the service has been able to continue in Scotland. Dr. Martins de Silva, are clinics prioritising certain groups of patients?
So when we first restarted fertility treatment after it was suspended last year, yes, we did prioritise certain patient groups, particularly the older women, because we felt that their treatment was deemed to be most time sensitive. But we resumed our normal waiting list management within a few weeks, and we continue to do so. So there are a small group of patients that were shielding that couldn't have treatment, and they're really the only people that would still have a degree of priority. But as Kelly's just mentioned, we're all working to within our waiting time standards, and we're not prioritising any groups at present. And I really hope that we don't have to in future.
Thank you. And coming back to Joanne, how long are the waiting lists for self-funding treatment from referral to egg collections and also for frozen embryo transfers?
Thanks, Gwenda. That will vary from centre to centre in the self-funded services. So the best way to get that information is for the patients to contact the individual self-funded services directly to find out that information.
And Joanne, should patients shield prior to egg collections and transfers?
Thank you. No, patients don't need to shield, but we still advise to continue to follow Scottish Government to make sure that they're keeping themselves and the public safe, and make sure that they're safe and well for their treatment. And that's advising not to attend any clinic appointments if you or anyone within your household is exhibiting symptoms of COVID-19, making sure that you're regularly washing and sanitising your hands. Please make sure that you're observing social distancing guidance. We also kindly ask that patients attend their appointment on time, not too early, and to try not to turn up late. We do space out the appointments to make sure that they're staggered for patient safety. And we would also request that patients continue to wear face coverings when they are in the services, but also within the hospital.
Thank you. And Dr. Lyall, is there a period of time patients should wait between their COVID vaccine and egg collection or frozen embryo transfers?
There's no evidence that the COVID vaccine has any impact on fertility. There's not really a biological way that could happen. There is good evidence, however, that the maximum impact of the vaccine isn't achieved until after the second dose. So with that in mind, patients might want to just think about the timing of their treatment just to take that information on board. Thinking about the timing of treatment, the other thing to consider might be any potential side effects from the vaccine. It seems that these are more likely after the second dose and can be sort of flu-like symptoms. So really just thinking about wanting to feel in the best place during treatment, and also not wanting to attribute any potential vaccine side effects to side effects of treatment. Patients might want to think about the timing just from that perspective also.
Thank you. And Dr. Martins de Silva, from referral, what are the waiting times for NHS sperm donor treatment?
Yeah, so there is a current shortage of sperm donors, and so waiting times are longer than our normal waiting lists. And I'm sure we would all like to say to patients that we're really sorry if you've been affected by this in any way. It's not just Scotland, the UK and other places in Europe have been affected by this too. And in fact, we were really set to launch a national recruitment campaign in 2020, but like a lot of other things, we've had to put it on hold because of the COVID pandemic. So it's been really challenging. It is really as disappointing for us as I'm sure it is for you, if because of these struggles trying to recruit sperm donors. So just to kind of put it in a little bit more context, to recruit and screen sperm donors, we need to, from about 100 notes of interest, we'll probably end up with only sort of 5 to 10 men that will actually be recruited and go on to donate sperm. So it's a lot of footfall because of the number of sort of stringent checks and multiple investigations that men need. And it's just really not practical and not possible right now to offer that wider audience of people for hospital appointments and so on. So as I say, we are aware it's a problem. Our thoughts are with you, and we are really sorry that your treatment has been delayed. On a more positive note, as we see more wider vaccination uptake and hopefully now an ebb in COVID infections, we really are poised and ready and set to get going with a recruitment donor campaign nationally. And as soon as the circumstances will allow that. So we, across all of the clinics in Scotland, are 100% behind that. On the other hand, if you've got somebody that you know who potentially, a friend or family member who would be willing to donate, we're very happy to see them and take them through that donation process. So all I can say is, as soon as we can safely run a donor recruitment campaign, we will. Keep an eye on our web pages and we will keep updating them as soon as information is available.
Thank you, and that's really positive news about the donor campaign that will be coming in the future. Just coming to Kelly again, if you have a failed medicated frozen embryo transfer, can you start a natural frozen embryo transfer straight away?
Hi, thanks, Glenda. So yes, it is medically possible, but please contact your individual clinic as they will be able to advise you on your individual case and the scheduling of the treatment within the individual clinic.
Thank you, Kelly. And coming to our final question and coming back to Dr. Maheshwari, what studies have been carried out to show the COVID vaccines do not affect your fertility or a pregnancy?
Thanks, Gwenda. Unfortunately, none of the vaccines have undergone any specific clinical trials in pregnant women. But as Dr. Lyall mentioned earlier, there is no evidence that fertility is reduced as a result of having vaccine for either men or women. There's no biological mechanism by which vaccine could affect fertility that we are aware of. And there is no evidence that the current vaccines will affect either fertility or in pregnancy. But on positive note, Pfizer and BioNTech are starting global trial on vaccines in pregnancy. They're hoping to recruit 4,000 healthy pregnant women from 18 years of age during around 24 to 34 weeks of pregnancy. And there is a plan for this study to be done in UK as well. They are shortlisting the sites from the UK. So hopefully we will have answers soon. And if anybody wishes to participate in the trial, please do so and contact your nearest center. So there is hope.
Thank you. And just before I hand back over to Emily, I would just like to say a personal thank you to everyone for taking the time today. I feel that the questions submitted and answered have been hugely useful and helpful. So thank you. And I'll hand back to Emily.
Thank you. And just to follow on from that, thank you for everyone who's watching this recording. If you have any questions or you'd like to reach out for some support or advice, do get in touch with Fertility Network Scotland coordinator. The details for that will be linked in the description box below. So you can ask about any issues you've got and also find out more about our support line and support services, including groups and webinars. So thank you everyone for joining us today, and another big thank you to the clinics for their time this afternoon. Thank you.